My name is Divanshu. Welcome to the channel GDC English. So I hope your preparation is going well and you are grinding yourself each and every day for the better version of yourself. So in this video, we're going to have another lecture of cardiovascular drugs, that is antihypertensive drugs, which are very, very, very much important for your GPAT pharmacist or DI exams. Okay. Let's start with the first question. So the first question says that following agents are predominantly arteriodilator except. Okay. So one of the following is not a arteriodilator. You have to choose one. Okay. Diazoxide, hydralazine, prazosin, minoxidil. Out of these four, one is not arteriodilator. Okay. So the option prazosin. Prazosin is in what? Is in a selective alpha 1 blocker. Okay. But out of this, prazosin is a selective alpha 1 blocker, which is not a arteriodilator. Okay. Diazoxide, hydralazine, minoxidil, that is MDH. You know the company MDH? MDH ka tikha lal, MDH, that masala wala ad. Okay, so through MDH, you can learn the drugs which are arteriodilator in nature. So M for minoxidil, D for diazoxide, H for hydralazine. These are the arteriodilator. They cause down in BP. Okay, so out of which prazosin is a selective alpha 1 blocker, which is not a predominantly arteriodilator. Okay, yes, prazosin. Which of the following is incorrect statement about sodium nitroprusside? The first let me know that what kind of drug is sodium nitroprusside? It is an arteriodilator, venodilator, or arterio plus venodilator. Drop the answer in comment section. Okay. So instantly acting vasodilator. It needs continuous infusion pumps and constant monitoring. It is relatively safe in higher doses. It decomposes at alkaline pH and exposure to light. Okay. So first option says that instantaneously acting vasodilator. Yes, it is correct option that it says the statement is correct that it is instantaneously acting vasodilator because sodium nitroprusside is always given through IV. So whenever you give a drug through IV, it will act instantaneously. Okay, so this one is correct option. Second, it needs continuous infusion pumps. Yes, just I have told you before that it is given by IV route only. So IV through infusion part, okay, infusion pump and constant monitoring because sodium nitroprusside may cause cyanide poisoning. Okay, so it needs constant monitoring. Okay, so this one is also right. It is relatively safe in higher doses. No, it is not safe because it may cause the cyanide poisoning, so it will not be a safe in higher doses. Whenever you give a drug in higher doses, it may precipitate a toxicity. Same case is of sodium nitroprusside also. When you give sodium nitroprusside in higher doses, it will not be a safe drug for you. Okay, so the right option is it is relatively safe in higher doses. This is an incorrect statement for sodium nitroprusside. Okay. So next question says that the mechanism of action of sodium nitroprusside is. So that sodium nitroprusside is a vasodilator. Okay, nice vasodilator. But it acts through which kind of downstream signaling? It acts through intracellular CGMP. Okay, it acts through intracellular CGMP, which is a secondary messenger, which is a secondary messenger. Secondary messenger. Okay. So in CAMP, you will see through increase in GS. Okay. GS what? Coupled receptor. GS coupled receptor. GPCR. Okay. So CGMP intracellular level gets increases through the sodium nitroprusside. Next. So the right answer is intracellular CGMP. Most commonly used drug in hypertensive emergencies is. Okay. So out of these four drugs, one is used in hypertensive emergencies. Hypertensive emergency in normal patient, not in a pregnancy. Okay. So alpha methyl dopa. Alpha methyl dopa is a DOC in pregnancy in the case of hypertension. Okay. Clonidine is also safe in pregnancy because it is not a teratogenic in nature. Nifedipine, no, it is not preferred usually during the hypertensive emergency. Okay. But if we talk about sodium nitroprusside is a drug that is a DOC, you may call also that sodium nitroprusside is a DOC in hypertensive emergencies. Okay. So when a person is having a around 200 by 110 mmHg blood pressure, okay, then whenever a person used to go onto the trauma, that is emergency condition, onto the hospital, what doctors they give an infusion, they give an injection of sodium nitroprusside in the emergency cases, okay, to lower down the BP. Okay, so most commonly used drug in hypertensive emergency is sodium nitroprusside, but it is not safe in higher doses, just we saw in the previous questions also. Okay, because it may cause cyanide poisoning. It may cause what? Cyanide poisoning. So one task is for you, that you have to tell me what is the DOC or what is the antidote in the cyanide poisoning. Okay, write down in the comment section. So which of the following antihypertensive is topically used for alopecia? What is alopecia? Alopecia is baldness, no hair at this area, no hair. That is baldness. Okay. So which of the antihypertensive is usually given for alopecia? Enalapril? No. Minoxidil? Yes. Isosorbate dinitrate? No. Labetalol? No. Minoxidil is very much common in these days because, let me tell you a story. Minoxidil is preferably used for as an antihypertensive drug previously, but it has a side effect of hirsutism. Hirsutism, that it may increases the growth of the hair around this or around the all over the body. So that's why, because of use of that side effect, it is now used for alopecia. Okay, so whenever a person is suffering for alopecia, now minoxidil oil is marketed these days. Okay, so minoxidil oil is marketed for the alopecia purposes, whereas baldness, okay, loss of hair. Okay, so minoxidil is used for the topically, that is for alopecia. Yes, no? Sure. SLE like reaction is caused by SLE. What is SLE first? You know, SLE is systemic lupus erythromatous. Okay, so systemic lupus erythromatous is a chronic autoimmune disease. Chronic autoimmune disease. Chronic autoimmune disease where the immune cell mistakenly causes harm to our natural or healthy tissues. Healthy tissues. Okay. So this is a kind of adverse effect of a drug. So which kind of a drug causes these? Okay. Hydralazine. Yes. Hydralazine is a drug which causes SLE like reaction. Okay. Rifampicin, no. Furosemide, no. Paracetamol, no. So if we talk about a trick, that is SHIP, that is SHIP. SHIP means for S for sulfonamides, H for hydralazine, I for isoniazid, and P for paracetamol. No, not for paracetamol. It is not for paracetamol. P for procainamide. Okay. P for procainamide. Okay. So these drugs may cause SLE like reaction. You can learn through it. Shift. Okay. Chalo. So SLE is like a autoimmune disease which may harm your natural healthy cells. Just like around in this picture, you can see there are rashes around your face. Okay, so hydralazine is one of the drug in this category which may cause systemic lupus erythematosus. Okay, now rebound hypertension on sudden stoppage of medication is mostly like to occur with rebound hypertension. So firstly we need to understand what is rebound hypertension. Rebound hypertension is a sudden increase in BP. Is a sudden increase in BP when an antihypertensive drug is suddenly stopped. Okay, so for example you are having a drug X for your BP condition. Okay, but after some time you just suddenly stop that drug suddenly. Okay, without any taken any advice from the doctor. So what will happen to you once you stop the drug for your BP? Then ultimately there is a sudden increase, there is a sudden shoot in your blood pressure. So this is known as the rebound hypertension. Okay, rebound hypertension. So out of these drugs, which of the following is causes the rebound hypertension? Okay, so one of the drug that is clonidine is most likely to occur, that is rebound hypertension. Okay, so clonidine. Okay, drug of choice in hypertensive emergency in pregnancy. Okay, nice. So this question I have told you in previous MCQ session also, that which kind of drug, what drug is a DOC in hypertensive emergency in pregnancy, not in a normal adult, but in the case of pregnancy. So hydralazine is a DOC in hypertensive emergency. Okay. So what kind of adverse effect does phentolamine do? That is cheese reaction. Okay, write in your notes, that is cheese reaction takes place through phentolamine. Phenoxybenzamine is generally used for the pheochroma pheochromocytoma. This is a kidney cancer. Okay, kidney cancer, that is adrenal gland cancer. To be precise, that is adrenal gland cancer. Okay, so if I remember correctly, that is this question. Phenoxybenzamine is asked in 2022 GPAT exam, that which kind of drug is generally used for the adrenal gland cancer? That is phenoxybenzamine. Okay, phenoxybenzamine is used for adrenal gland cancer. Okay, so you may note down that hydralazine is a drug of choice in hypertensive emergency in pregnancy. Okay, so as antihypertensive drug that causes positive Coombs test is. So what is a positive Coombs test? So one of these four drugs may produce autoantibodies. So these autoantibodies are generally formed against what? Against RCB, not RCB, not Royal Challengers Bangalore. Okay, not Royal Challengers Bangalore. It is against for RBC. There is nothing against RCB. We all love the RCB. Okay, so autoantibodies are generally produced against RBC, that is red blood cells. Okay, so these autoantibodies are detected by the Coombs test. Combe test. Okay. So which kind of drug generally generate these autoantibodies? Because the drug is methyl dopa. Okay. So this is also has been asked in previous exam that which drug which is given in pregnancy causes positive Combe test. So the drug is methyl dopa. Okay. Next. Following drug dilates both arteriolar and venous vessel. In the first or second question I have just asked that how sodium nitroprusside lower downs the BP. Here you have the answer that sodium nitroprusside dilates both arteriolar and venous vessels. Okay. Diazoxide is for arteriodilator. Arteriodilator. Hydralazine, arteriodilator. Minoxidil is also arteriodilator. Okay. Whereas sodium nitroprusside is a mixed, that is arterio and venous vessels. Dilates both the arterio and venous vessels. So, what is the mechanism of action of diazoxide? Should I tell you? Yes, I should have tell you that diazoxide is a arteriodilator. Yes, arteriodilator. But how it will cause the arteriodilation? It will cause arteriodilation through potassium channel opener, that is through the activation of GI coupled receptor GPCR protein. Okay, GI. So when you will say a GI receptor downstream signaling, you will see there is a opening of potassium channel. Okay, through which there will be a arteriodilation. Okay, potassium channel opener. Oh, nice. So, antihypertensive drugs to be avoided include all of the following except. Okay, so there are some combinations which are generally made. So, out of this, which are to be avoided except. Okay, so out of four, there is a there is a three wrong combination which are wrong combined. Okay, but one of the following is right combination and generally used as a marketed product. That is very common. Okay, so ACE inhibitor with ARB, no, it should not be given combinedly because there is a high chances of renal failure, and may cause the hyperkalemia. Okay, and if we talk about that verapamil or diltiazem with beta blocker, there is a strong adverse effect that may be called as that is AV block, that is arterioventricular block, AV node blockage. Okay, so whenever take a drug verapamil or diltiazem with beta blocker, they just lower down the conductivity of the heart. Okay, that's why it may cause the AV block. ARB diuretic, yes, this is a very common drug, that is ARB. For example, tell me certain, no? Tell me certain plus hydrochlorothiazide. Hydrochlorothiazide. These combination of drug is generally marketed right now and are very much common for the BP patients. Okay, so the right answer will be your ARB plus diuretic. Okay, ARB plus diuretic. Nice. Advantages of angiotensin converting enzyme inhibitors as antihypertensive include the following except. Okay, so you have to click the disadvantage of ACE inhibitors. Okay, so out of these, three are advantages, one is disadvantages. So you have to click the disadvantage. Okay, so they tend to reverse left ventricular hypertrophy. Yes, they do. They tend to reverse left ventricular hypertrophy because ACE inhibitor DOC for CHF and hypertension. Their efficacy is not reduced by non-steroidal anti-inflammatory drugs. No. NSAIDs. NSAIDs generally do what? They are generally lower down the PG synthesis and may cause what? It may cause what? Sodium plus hydrogen retention. Okay. That's why their efficacy is not reduced, there gets elevated. Okay. Of what? ACE inhibitors. Okay. They do not worsen blood level profile. Yes, it is correctly that they do not impair work performance. Yes, it is right. So the option will be their efficacy is not reduced by non-steroidal anti-inflammatory drugs. Enalapril differs from captopril in that it blocks angiotensin receptors. No, there is a no way of discussion that enalapril or captopril acts on angiotensin 2 receptor because enalapril or captopril generally acts on ACE enzyme, which is responsible for the conversion of angiotensin 1 to angiotensin 2, not on the receptors. Okay, it does not produce cough as a side effect. No, all the ACE inhibitors generally produce cough as a side effect, whether it is enalapril or it is captopril. Okay, so it is less liable to cause abrupt first dose hypertension. It has short duration of action. No, it is wrong answer. C1. It is less liable to cause an abrupt first dose hypertension. That is will be a right answer. Okay. Choose the incorrect statement regarding hydralazine. Okay, nice. So it acts as a vasodilator by directly acting arterioles. Nice. Okay, right. It acts by generation of nitric oxide, interfere with calcium release, and open off potassium channel. Yes, it is right. Causes drug-induced systemic lupus erythematosus like syndrome and sweet syndrome. Yes, it is also right. It is contraindicated drug during pregnancy. No, it is not contraindicated during pregnancy because it is a DOC in pregnancy. What you are telling? Okay, so it is a DOC, not contraindicated during pregnancy. So fourth option is right in this question. Chalo. Which of the following statement about calcium channel blockers are true? Okay. The first option says that CCBs dilate the arterioles, resulting in increased peripheral vascular resistance. Okay. CCBs are drug of choice for patients with left ventricular hypertrophy and previous myocardial infection. Okay. Short acting dihydropyridines are avoided in hypertension. Okay. IV clevidipine causes quick reduction of PP. Okay, so once you see the first option, that is CCB dilates the arterioles, resulting in increased peripheral vascular resistance. So they generally not increase, they generally decrease peripheral vascular resistance. How? Because there will be a vasodilation. No. So whenever there is a vasodilation in here, there is a vessel. Okay. So whenever the diameter, the radius of this um, vessel gets increased, okay, increased. So automatically the TPR, that is total peripheral resistance, also may down. Okay, because of the vasodilation. So there will be a decreased peripheral vascular resistance. Whereas CCBs are drug of choice for patients with left ventricular hypertrophy and previous myocardial infarction. No. CCBs are not the drug of choice. ACE inhibitors are the drug of choice for left ventricular hypertrophy, which is also at the CHF or myocardial infarction. Okay, so P wrong, Q wrong. Short acting dihydropyridines are avoided in hypertension. Yes, it is a right option because Short-acting dihydropyridines, for example, that is nifedipine. Nifedipine. These are avoided in hypertension because they may cause the reflex tachycardia. Okay, so there is a important adverse effect. You may note down that short-acting dihydropyridines, just like nifedipine, causes reflex tachycardia and should be avoided in hypertension. Okay, IV clevidipine causes quick reduction of BP. Yes, it is right because it is given through IV. Now, whenever you give a drug through IV, it may cause a quick solution. It may cause a quick reduction of BP. So, R and S is right according to this statements. Okay. Yes, R and S will be the right option. Okay. The common side effect of alpha 1 adrenal receptor antagonist antihypertensive agent are. Okay. So the right option will be, let me say the options for you. That is, first one is gout, ankle edema, postural hypertension, and CHF. Okay. So gout, no. Gout is not a common side effect of not a side effect of alpha 1 antagonist. Ankle edema, no. Postural hypertension, yes, is the one of the major side effect of antihypertensive agent, which is of alpha 1 receptor antagonist. Postural hypertension. CHF, yes, CHF, because it will cause a vasodilation of the coronary arteries. Okay, but somehow it will cause a CHF. Okay, RNS. RNS will be your right option. Carvedilol asked from your classification. Selective beta 1 agonist? No. Selective beta 2 agonist? No. Both alpha and beta agonist? Yes. Alpha and beta agonist. Carvedilol. Carvedilol and you may call as labetalol. Labetalol and carvedilol are both alpha beta agonists. Selective 1 beta agonist, just like your atenolol, bisoprolol, yes, or metoprolol. Okay, so these kind of drug are your cardioselective. That is second generation beta 1 blocker. Selective beta 2 agonist, that is salbutamol, terbutaline. Okay, so these kind of drugs are your selective beta 2 agonist. So carvedilol is your both alpha and beta antagonist. I am really sorry. Not it is not an agonist. It is a beta alpha and beta antagonist. Sorry, it happens. Sorry. Okay. So calcium channel blocker with predominant peripheral action is. This is a nice question. That is nicardipine, verapamil, nifedipine, diltiazem. So out of these, one drug is predominantly acting on as a peripheral action. Nicardipine, yes, it may cause peripheral action, but not in the extended amount as just nifedipine do. Nifedipine is a calcium channel blocker with predominant peripheral action. It may cause your vasodilation. Okay. Diltiazem and verapamil generally acts through on the cardiac contractility. Cardiac contractility. Okay. So nifedipine will be the correct option. Nifedipine. Okay. So which antihypertensive drug has to be avoided in a diabetic patient who is taking insulin? Okay. Guanethidine, alpha methyl dopa, propanolol, or hydralazine. So propanolol is a non-selective beta 1 blocker, or you may call as beta blocker. Okay, so it is a non-selective beta blocker. It means that it will act on all the receptors, beta 1, beta 2, and beta 3. Okay, so beta 2. Beta 2 is responsible for glycogenolysis and gluconeogenesis, which are responsible for increase in the increase in the sugar concentration in your blood, that is increased blood glucose level. However, because propranolol inhibits this beta 2 receptor, it will do what? It will just downregulate that insulin secretion through beta 2 receptor. Okay. So propranolol should be avoided in the case of diabetes condition. Okay. Yes, propranolol. So these are the questions that we have discussed among the antihypertensive drugs. So I hope I made you clear about these questions. So if you have any doubt or any question, just write down in the comment section. We will look onto it. Until then, tata, bye bye, and take care of yourself. Stay with GDC.